Hi, this is Dr. Fish. Today I wanted to talk to you about the complexity problem for electronic health record systems, which are also called electronic medical record systems. I haven't been doing much talking lately on this topic, but I think it's time to finally expose and describe what the main problem is with electronic health record systems. Certainly, this presentation is appropriate for medical providers, but if you're a patient, I think you might find this interesting. But really, the target audience is programmers and experts who design these systems and get us doctors to use them. Well, I wasn't going to spend too much time on the background of the EMR, since most doctors and certainly most developers understand how complex the systems can be. This little cartoon represents what a doctor might do going through different steps in the EMR. Each little dot you see represents a decision point. It could be a click, it could be a drop-down menu, or it could be a place where the doctor types in information. And of course, the whole goal here is that the patient shows up sick and we want to get them better. So all the while we are going through this incredibly complex process, we are of course making medical decisions, diagnoses, prescribing medications that have to be somewhat precise, and also still trying to connect with our patient. But complex EMRs are actually even more complex than you see here. In fact, each little dot represented here probably has tens or hundreds of decision points underneath it. So you can see that the complexity builds on itself. Later in the talk, we'll describe why this is. And during this talk, if you are a developer or a super user or someone who implements EMRs, you might better understand through the talk why doctors often go through the process and end up more like our patients. Let me be a little bit more precise so everybody knows what I'm talking about. So I said each of these dots represents something in your pathway through the EMR, such as chief complaint at the start, and that progresses, of course, onto history. And you've got to get through this, so there's the medication check, and then we have examination, come up to the assessment, print visit summary, e-send, and billing. So really, what is a doctor to do when faced with this level of complexity? Well, what I do, and I think what most doctors do, is we try to keep it simple. We ignore the periphery. We ignore the areas that we don't want to go, and we try to keep to our path. But as commonly happens when we're visiting a patient, there are variabilities. And so we might have to do the medication check first and then immediately e-send a drug. Well, this takes us off our path, and while we're calculating how to get from medication check to e-send, we're also, again, dealing with a patient and trying to listen to their story and make critical medical and scientific decisions on their behalf. What this all leads to is what I call EMR Induced Cognitive Dystrophy. I think by the end of the talk you'll understand what this means. Here is an example of one of the most dreaded occurrences when using an EMR, probably even more dreaded than the system crashing itself. What if your path is blocked? You're working along your rote, memorized path, trying to get the patient out the door, and you find that you reach the yellow dot, which could be any function in the EMR, and you're forced somewhere else. That path is no longer available. Your administrator or your super user or perhaps even a government agency has told you, well, you've got to enter different data here. Or it could be something clinical too. You might have to prescribe a drug you've never used, or you might have to enter a series of symptoms that you've never done before. Well, you go on this alternate path, but eventually you've got to find your way back to that yellow dot, because that yellow dot will lead you back eventually to the pathway that gets you out of the encounter and completes the visit for the patient. Well, this can certainly be frustrating, but even worse, it is anxiety-provoking. What could possibly cause an excursion like this away from your usual path? Well, things like PQRS, and finding a code, and entering a CQI data point, and then, of course, meaningful use. So I think it's time for a quick refresher on brain physiology. Remember that anxiety is a very low brain function, and anxiety hinders higher brain functions. If you have a lot of anxiety, you lose your higher brain functions. For all the non-doctors out there, think of it this way. This is your brain. This is your brain using the EMR, and this is your brain using the EMR with a side of bacon. Let's get back on topic. So, EMRs and EHRs are very complex. Well, it turns out that you can sort of measure the complexity of a computer application using what's called application function points. These basically tell you how many things can an application do. So function points equals complexity. If you have a lot of function points, you're going to have a complex application. Let's think about some basic applications we use every day, like a word processor or Outlook or any other email program or a web browser. Well, these applications have about 5,000 functions, believe it or not. You probably only use 100, 200, 300 of those functions when you use the program. They can become fairly complex, however, when you go beyond those 200 or 300 familiar things. An example of a function that an email program might have would be reply to, or you could highlight some text and bold it. You could execute a spell check, or you could execute your spell checker. You can delete something, you can flag something for follow-up, or mark it as spam. Now, what about running the space shuttle? Well, I don't have absolute numbers on this, but I'm guessing that the space shuttle probably has something like 250,000 functions, and that's for the program that is run by the engineers in this room. Look at this room. There's 10 engineers. They each have 4 or 5 screens in front of them, plus they share the big screens. So obviously a very complex endeavor requiring multiple people to run a single computer program. Well, as it turns out, navigating an EMR is a lot more like running the space shuttle program than working on a word processor. A fully functional EMR, even one maybe built back in the 90s, might have as many as 115,000 function points. So you can see even on a logarithmic scale that the EMR is much more like a space shuttle program than it is like using Word. And remember, that space shuttle program required a room of engineers who were trained to use that system. Well, we doctors have little training, and we often have to use multiple different EMRs, and so we're doing something very complex at the same time that we're doing medicine, which is just as complex. I would say that, therefore, EMR complexity is real, and it may be the most important reason for EMR and EHR failure. I suspect it's all sounding a little bit dire, but to be fair, EMRs have improved communication within practices and have improved safety of medical care. What we talked about, however, is how they can be frustrating, and how that frustration and the complexity of the systems leads to anxiety. That complexity and anxiety combine to create different levels of failure. Maybe not complete failure of the EMR, but failure on a certain scale. I suspect you're now waiting to hear my solutions to this problem, to the problem of EMR complexity. But as you can see, based upon the status bar of this video, this presentation is almost over. I would just keep in mind that the EMR complexity problem we're talking about is almost purely a numbers game. There are just too many things to think about and too many things to click through in an EMR to make it simple. All the while we're practicing complex clinical medicine. The message is for developers and legislators and administrators: when you decide to add a click, or to add a menu, or to add a selection drop down to my EMR, you're taking me off that critical path. The best solution is to keep it simple and for me to find my pathway through this complex EMR. What you can do as an administrator or a super user or a programmer is help me mitigate anxiety so that I can make my way through the EMR without spending too much time thinking about it, and use my higher brain functions to help my patients. But as I said, this presentation was to talk about the problem, and we'll talk about the solution at some other time. Right now it's the weekend, and well, actually I don't have any time to golf. I have to go work on the EHR and catch up on my charts from last week. Thanks for listening.